item, you'll see a nurse's note, assessment, vital signs, some sort of information you need to interpret. Then you'll have a passage and word choices that you'll need to drag and drop to fill that passage. Here we see a nurse's note that reads, "The removal of the client's indwelling urinary catheter was attempted. Perineal hygiene was performed before the removal. The urine collection bag was emptied with 450 mLs of clear straw-colored urine. 2 mLs of fluid was removed during deflation of the balloon. Resistance was felt when the tubing was removed, and the client reported discomfort." So now we'll look through our word choices and select which action we should drag and drop to complete the sentence. Prior to attempting to remove the catheter again, the nurse should blank. As you can see, this is really just a fancy way of asking you a multiple choice question. It might say, which of these actions should the nurse take prior to removing the catheter? A, place a warm compress. B, cut the balloon inflation valve. C, position the client at 45 degrees. Or D, further deflate the balloon catheter. They're asking you to drag and drop, but other than that, nothing has changed. And of course, the answer is further deflate that balloon catheter. If we only took out 2 mLs, it's highly likely there's a little bit more in that balloon, and that's what's causing the resistance. So check to make sure you've deflated that balloon completely and try removing that catheter again. You assess the client 2 hours after a PCI that was accessed via the femoral artery. You update the nursing note with the following entry. The client is restless and not feeling good. The femoral catheter site remains clean, dry, and intact. Extensive bruising is noted over the flank area with some induration. Reports no pain. Vital signs were obtained and the healthcare provider was notified. The vital signs are an oral temperature of 97 Fahrenheit, a pulse of 110, respiratory at 19, blood pressure of 100/67, and an oxygen saturation of 95% on room air. So based on this nurse's note, complete the sentence below. The client may be showing early signs of blank based on blank and blank. In a rationale item, the NCLEX is asking you to pair information. They want to know that you can not only identify what might be going on with this client, but what assessment findings made you think that. My advice to you is to start with those assessment findings. We have 4 listed in my drag and drop box: heart rate, blood glucose, blood pressure, and restlessness. Which of those are abnormal? The heart rate and the restlessness. We have a high heart rate, tachycardia, and it's never normal for a client to be restless. Given the procedure they had and those assessment findings, what am I worried about? Look at your conditions: DKA, shock, NMI, or AFib. Definitely shock. I'm worried that this client could be bleeding. I'm thinking maybe it's around those kidneys due to that extensive bruising over the flank area. That leaves us with our final answer. The client may be showing early signs of shock based on those assessment findings of heart rate and restlessness. Now, if all of that seemed overwhelming to you, I urge you to break this down into 3 multiple choice questions. Make this really simple. Say the client may be showing early signs of what? A, DKA, B, shock, C, MI, or D, AFib. That's your first question. Easy does it. Then go to your next question. The client may be showing signs of shock based on which assessment findings? Does A, the heart rate, show signs of shock? Yes, absolutely. Does B, the blood glucose, show early signs of shock? No, we didn't even get a blood glucose. That's ridiculous. Don't choose that one. You get my gist. These NGN items might look scary at first, but we can always break them down into something more simple. You guys have got this. You assess the... All right, we have a 48-year-old coming in with what looks like an asthma attack. The nurse administers albuterol, but then the client starts reporting sudden onset chest pain. So in this drop-down item, you're going to have a little paragraph there. Here we have 2 boxes or blanks, and you're going to be able to click, and some options will drop down for you to complete the sentence. I recommend taking these 1 question at a time and really breaking them down into a simple multiple choice. So here it reads, the nurse understands the client's chest pain was caused by the albuterol because this medication blank. You're going to click on that blank and have 3 choices. Was it because of increased myocardial oxygen demand, a lowered heart rate, Or did it cause parasympathetic stimulation? You know albuterol raises the heart rate, so it's not B. And you know the parasympathetic nervous system is rest and digest. And this client went more into fight or flight, so it's not C. The correct is that it increased myocardial oxygen demand. And because of that, you want to get a 12-lead EKG. Albuterol can cause tachycardia. Tachycardia increases myocardial oxygen demand, and we would like to see that rhythm so we know exactly what's going on. There is a lot of information in these NGN items. Take a big deep breath and let's pull out the most important information. Starting with this history and physical, we have a 23-year-old with a history of type 1 diabetes. He feels warm, unwell, thirsty, lethargic. Now let's check out his labs. The NGN will give you reference ranges for your lab values. Here you see that we have hyperglycemia and his urine is positive for ketones. That should clue you in on what's going on. Looking now at his orders, we see a pretty typical set of insulin, fluids, and labs that we would expect for a client in DKA. That insulin is going to help move glucose into the cells and get that high capillary blood glucose down. That normal saline is an isotonic fluid to go into the vessels and stay in the vessels so that we prevent hypovolemic shock secondary to polyuria. Now for the drag and drop rationale. You are going to see a sentence with 2 blanks and you'll be able to click and drop down a list of options. Don't let this freak you out too much. It is a glorified multiple choice question. The client is at highest risk for developing A, hyperglycemia, B, hypokalemia, or C, hyponatremia. A, hyperglycemia, that doesn't really make sense. The client's already hyperglycemic and we're giving him insulin to lower that blood glucose. B, hypokalemia is correct. When I give that insulin, not only does it move the sugar inside the cell, but the potassium as well. So we can see that potassium level drop. C, hyponatremia, also doesn't make sense. We're not really looking at sodium levels very much during DKA. So my first question, the client's at high risk for developing B, hypokalemia. And then it's time for the next sentence. The client's at risk for hypokalemia due to the prescribed blank. A, regular insulin, B, normal saline, or C, metoclopramide. Which one of these meds can possibly cause hypokalemia? It's your regular insulin infusion. Just like we said, you want to watch out for that insulin moving potassium back inside the cells. And that's that. Looked really intimidating at the beginning with that history and physical, those labs and those orders, but at the end of the day, it was just 2 multiple choice questions and you nailed it. So a client's brought into the ED. He's agitated, pacing, disoriented. His parents state that he hasn't been taking his valproic acid and hasn't eaten anything in 2 days. All right, that's already a big warning sign. When you assess him, he states he's the chosen one. His speech is fast-paced and tangential. You get some orders and you see these 3 meds: lorazepam, D5W, and valproic acid. So for a drop-down table NGN item, you're going to have a list of items to the left. Here we have medications. And then when you click to the right, certain things are going to drop down and you'll have to pick one of them. I want you to think of this simply as a list of multiple choice items. Start one at a time and work your way down. First up, we have lorazepam. What is the nursing action you need to consider for lorazepam? Take this one question at a time. Should you monitor liver function tests? Should you monitor the client for hyperglycemia? Or should you initiate fall precautions like raising the side rails of the bed? That's it, you know it. Lorazepam is a benzodiazepine. You know it is a sedative. It's going to make this client sleepy, so go ahead and initiate those fall precautions. Boom, one question down. Let's move on down to our next medication. Okay, we're down to valproic acid. I've already checked off lorazepam, and I know that's initiate fall precautions. So for valproic acid, do I monitor their liver function tests or do I monitor them for hyperglycemia? I'm actually having trouble remembering this. I'm not too sure, and this might be when you start to panic. Test-taking tip for you. If this is giving you trouble, just move on to the next. Stick to what you do know. D5W. That's dextrose. What is dextrose? Sugar. Look at the two items you have left. Liver function and monitor for hyperglycemia. That's blood sugar, right? If you're giving your client sugar, should you monitor for hyperglycemia? You bet. So go ahead and fill it out. D5W, monitor that client for hyperglycemia. And that leaves us with our last med. For valproic acid, we monitor liver function tests and our CBC. Okay, you finished your drop-down table. The max score here is 3. You'll get 1 point for each one of these you picked correct and 0 for any incorrect. There are no deductions here. A client comes into the ED with epigastric pain, shortness of breath, and dizziness. This started 8 hours ago. It's getting worse. They're pale, diaphoretic, and have a history of type 2 diabetes. When we take a look at their vitals, they're tachycardic, hypotensive, desaturated. So we grab a 12 lead and we see sinus tach with ST elevations. It's your job now to put all of this information together and decide which of these actions are indicated or not indicated. A matrix question can look like a lot at first, but it's really just a compilation of multiple choice questions. Take it one row at a time. Each row is one question. Should you establish cardiac monitoring? Absolutely. I'm worried about those ST elevations. You should not obtain a prescription for albuterol. Even though this client is short of breath, albuterol increases the heart rate and this client is tachycardic. Obtaining an IV is indicated. We're worried about an MI and this client very well may need IV medication. A CT is not indicated. If this client is going anywhere, it's to the cath lab. And please apply supplemental O2. Your client is desaturated. So a matrix multiple choice is just a table of multiple choice questions. Treat each row as one individual question and you'll be fine. You're caring for a 15-year-old who reports abdominal pain starting this morning that's getting worse. Her parents say she had a temp, 100 degrees Fahrenheit, and acetaminophen did not make the pain or temperature go away. She's reporting anorexia, nausea, and 2 hours ago started vomiting. When you ask her about her pain, she describes it as crampy and in the right lower side, and it gets worse when she coughs. You ask her about sexual activity, and she is sexually active without birth control. So our job is to look at these different possible conditions and decide which assessment findings either indicate or do not indicate these conditions. Let's make this easy. Each row of this matrix is a select all that apply question. So select all that apply. Can nausea and vomiting indicate appendicitis? Yeah. Pregnancy? Yeah. Cholecystitis? True. Check each of these responses. Periumbilical pain would indicate appendicitis, but not pregnancy or cholecystitis. Fever could indicate appendicitis or cholecystitis, and same for anorexia. There you have it. A matrix multiple response is just a bunch of SATA questions. Treat each row as its own SATA and you'll be fine. So a client's presenting to the ED with epigastric pain, shortness of breath, and dizziness. This started 8 hours ago. It's getting worse. They're pale and diaphoretic. They have a medical history of diabetes. They state their blood glucose has been very high, but when you check it, it's 110. Now, in a select N item, the stem of the question is going to tell you exactly how many choices you need to pick. So it's not like a SATA where it says select all that apply and you just pick however many you want to. They're actually going to give you a number. So here we say which 5 client findings require follow-up by the nurse. You're going to read through this list and you are going to pick 5. So my testing strategy is actually the exact same for SATA questions as it is for Select N. I recommend that you take each of these answer choices and treat it as a true or false question. And then when you get to the end, see if you have the correct number, and it'll kind of serve as a double check to make sure that you're on the right track. So let's try it. Is epigastric pain a finding that requires follow-up? True, select it. What about a blood glucose of 110? False. That's normal. No need to follow up. How about a history of diabetes? False again. As a rule of thumb, in the ED, I'm not following up on long-term past medical history. I'm more worried about acute presentations and life-threatening illnesses. So what about shortness of breath? Do I need to follow up on that? You better believe it. That is a good reason to come to the ED. That's one of our ABCs of prioritization. I should follow up. How about if my symptoms are progressively worsening? Sure thing. I do not like vital signs and symptoms trending in the wrong direction. Symptoms getting worse, patient getting worse. I don't like that as a former ED nurse. Now, what about these reports of dizziness? Is that something I expect with the patient's history and whatnot? Nope. And if I don't expect it, then it requires follow-up. Now, lastly, pale skin and diaphoresis, does that require follow-up? Well, you know it does because that falls under your C, under your ABCs of prioritization. But even if you didn't remember that, you know you have to pick 5 findings, and this is your 5th client finding requiring follow-up. So there you go. Same kind of strategy as a SATA question. Turn them all into true or false questions. And then when you get to the end, use that number that you know you should have as a way to check yourself. Here, we were supposed to select 5 findings that required follow-up. And when we got to the end, we had 5 findings. So I had a pretty good idea that I was correct. You're going to get +1 for every right answer that you had, +0 for anything wrong that you selected. You're not going to get anything deducted. So you'll come out with the total of those correct answers you selected. Maximum score here was 5 possible points. This type of NGN item starts with some sort of nurse's note, order, medication that you have to read through to get an idea about the client. Pause your video here to read the nurse's note. Next, you'll go through the progress note and actually highlight the items that indicate the client is ready for discharge. So when you take your little mouse over the item while you're taking the NCLEX, highlight will pop up over each sentence. You're not actually going to have to click and drag over each word. Highlight is just going to pop up over each area of the text, and you're going to click over which parts indicate the client is ready for discharge. So I recommend you take it as a bunch of true or false questions. All right, so for example, look at the first sentence with me. The client was alert and oriented. Does that indicate to you that the client is ready for discharge? Yes, of course. Highlight that sentence. What about he described his mood as good and had a cheerful affect? Of course. Click to highlight. I certainly think denying suicidal ideations is a good sign, so I'm going to highlight that as well. Now, if he states he's not sleeping well, is that an indicator he's ready for discharge? False. Let's not highlight that. And what about if he states that he's not been attending group therapy? Again, not an indicator he's ready for discharge, not going to highlight it. Next, he states he'll be staying with friends from church. That's a good indicator. Let's highlight it. Lastly, if he tells you he's got an outpatient therapist, that's 2 thumbs up, definitely a good sign. So there's your answer, future nurses. There were 7 statements that you could highlight. 5 of them were correct. Remember, they were just true or false statements. They wanted you to click on the statements that indicated your client was ready for discharge. Honestly, pretty straightforward. Since 5 of them were correct, there were 5 possible points. You got 1 point for every statement you clicked on that was correct. And if you clicked on anything incorrect, you got a point deducted for a maximum of 5 possible points. So you're reviewing data on someone prescribed lithium. You've got this chart, you see all of their lab data, and basically you've just got to click with anything that requires follow-up. So on these highlight tables, when you use your mouse and scroll over, it's basically going to light up anywhere that you can click. Anything that requires follow-up, you click it to highlight it. That's that. I recommend that you treat these highlight tables like a series of multiple choice questions. Just look at each cell and ask yourself, hey, true or false, does this require follow-up? If it does, highlight it. If not, move on. So let's look at the first one, white blood cells. You can see they're slightly elevated, but am I gonna follow up on a white blood cell count that's just 500 over normal? Not really. So don't highlight it, move on to the next. Next question, should we follow up on a sodium level of 130? It's just slightly below that normal range that we see, but remember that lithium is a salt. And if we've got an abnormal sodium range, that can drive lithium toxicity. So I actually do want to follow up on this. Highlight it. Now let's look at that potassium. We see 3.7, it's right within the normal reference range. No need to follow up, don't highlight it. On to the next question. Looking at our BUN, it's 29. That's significantly above the normal reference range. It's telling us the client's dehydrated. And we know that's a problem with lithium. Again, lithium's a salt. Our client's getting dehydrated, concentrated. That can drive that lithium level up, and we know that that's a problem, right? It has a narrow therapeutic index. So we need to follow up on that BUN. You guessed it. Highlight that BUN. Absolutely. Now let's look at the creatinine value. It's within normal range. Not needed to follow up. Move on to your next value. Lastly, we have lithium. 1.5, that's a toxic level, kind of what we would have expected given our other lab values. So of course, you're going to follow up. After highlighting lithium, you've completed your table. It was basically 6 true or false questions. You looked at each lab value. If it was abnormal, you highlighted it to follow up. And if it was normal, you moved right along. All right, future nurses, with a bow tie, you're always going to start out with some info over on the left-hand side of the screen and then get into the bow tie over on the right. So here, we've got a client coming into the ED, left-sided facial droop, can't really move left side arm and leg, expressive aphasia, so having a hard time talking. Husband said this started out of nowhere, boom, 45 minutes ago at dinner. She's got a pretty good past medical history here. AFib, hypertension, diabetes, hyperlipidemia. We look at her vitals. She's got a little bit of a low-grade temp, nothing to write home about. Pulse and respers are pretty normal, but I'm impressed by that blood pressure. Notable hypertension going on. So now getting over to the bow tie, here's what you're going to see. 1 potential condition in the middle, 2 actions to take on the left, 2 parameters to monitor on the right. You guys, this is just a really fancy drag and drop. You're dragging and dropping 5 different items into their respective location. I recommend you start off in the middle with what you think is going on. It's got to come from that middle column potential condition. So what do you think it is? Based on what we talked about, is it Bell's palsy, a complex partial seizure, a complex migraine, severe hypoglycemia, or a cerebral vascular accident? I know you guys got this. It's a CVA or a stroke. So my next recommendation is move on to the actions to take. What are your priorities when your client is having a suspected stroke? Well, you need to figure out if it is a stroke and what type of stroke it is so you can treat it properly, right? So read through those actions to take and then drag and drop them into those appropriate bubbles. Let's look through them. Should we get them to CT? Yes, we've got to figure out if this is ischemic or hemorrhagic so we know what to do. Should we get a manual blood pressure? Well, we already got a BP. We know she's hypertensive. That's really not going to help us with this situation. Should we prepare her for an LP? That's not going to help us either. Should we get lab work? Yes, I especially want to check a glucose because we know hypoglycemia can imitate a stroke, and that could really help us out. Lastly, should I transport her to an MRI? Well, no, I'm already getting a CT. Your last selection with a bow tie is what parameters you want to monitor to see if this condition is improving. So read through and see, based on a stroke and getting a CT and labs, what's going to tell you if this is getting better. You got it. It's that Glasgow Coma scale and your vital signs. Easy, quick, and it'll let you know if this stroke is improving or getting worse. With all of your bow ties, you're getting a point for correct answers, no points for incorrect answers, and no deductions. The maximum you'll be able to get is 5 points. Good luck on your NGN. If you need more practice, head over to archerreview.com where we've got tons of practice cues on every single one of these items. See you there.